Now let me discuss the various routes of the drug administration. Now you see here, the drug which is administered, either it is via the local route, right, either it is via the local route, or the drug can be administered by the systemic route. Now let me tell you what are the local routes of administration and what are the systemic routes of administration. Now you take the local routes of administration. The local routes of administration of the drug is again in three forms, right? So we have the topical route of administration of the drug, right? The topical route in the sense either over the skin and mucous membrane, right, either over the skin and as well as the mucous membrane. So that is the topical route of administration of the drug. Or the drug can be administered directly into the joint, and that is called as intra-articular. Right, and that is called as the intra-articular route of administration. Or the drug can be administered into the spinal cord, that is into the subarachnoid space, and that is called as intrathecal. Right, so intrathecal route of administration is the route where the drug is administered into the spinal cord, that is into the subarachnoid space. Now you take the systemic route of administration. The systemic route, remember, either it is the enteral route, right, either it is the enteral route or the parenteral route. Right, the enteral route or the parenteral route. Now you take the enteral route. The enteral route is the one where the drug is administered through gastrointestinal tract, right, where the drug is administered through the gastrointestinal tract. Now through the gastrointestinal tract means, remember, the drug is administered either in the oral route, right, either in the oral route, or the drug is administered via the rectal route. Okay, so the oral route of administration and as well as the rectal route of administration. Alright, so these are the enteral routes of administration. Now you take the parenteral route. The parenteral route, remember, it would be either intravenous route of administration, intramuscular route of administration, that is into the muscle, or just beneath the skin, that is subcutaneous route of administration, or it would be just beneath the tongue, that is sublingual route of administration, right. Next, across the skin, that is the transdermal route of administration, right, and the other one is through the nose, that is nasal inhalation. Right, that is nasal inhalation. So these are the various routes of administration of the drug. So the local route and as well as the systemic route. Local route, either it might be topical, intra-articular, that is directly into the joint, and directly into the spinal cord, that is intrathecal. The systemic route of administration, that is enteral and as well as parenteral. Enteral is through the GIT, that is either the oral route or the rectal route. You take the parenteral route, either it would be intravenous, intramuscular, subcutaneous, transdermal or nasal inhalation. Now let me tell you what are the drugs which are administered via the local routes and what are the drugs which are administered via the systemic routes. So continuing with the routes of administration, so you take the local routes, right? Local routes include the topical application on the skin and mucous membrane, as well as the other routes, that is intra-articular and as well as intrathecal. Now let me tell you some of the examples. Okay, so you take the drugs which are administered through the local routes. So through the local routes, for example, you take the intra-articular route, right? Intra-articular route. Intra-articular route is the one where the drug is administered directly into the joint. Now what are the examples of these drugs is, they include steroids, that is hydrocortisone. Alright, so the hydrocortisone, it is administered directly into the joint. Now you take the intrathecal. Right, you take the intrathecal route of administration. The intrathecal route of administration examples are the amphotericin B. Right, amphotericin B. So amphotericin B, it can be directly administered into the spinal cord, and this will be asked as multiple choice questions, right? So which are the drugs, for example, can be administered by intra-articular route, and which are the drugs, for example, can be administered by the intrathecal route. Alright, now you take the systemic routes. Now what did we discuss the systemic routes? The systemic routes include the enteral route and parenteral route, and that includes oral, sublingual, transdermal, nasal, inhalation, rectal and other parenteral routes like intravenous, intramuscular, intradermal and subcutaneous route. Now let me tell you some of the examples of the drugs which are administered via the oral route. Majority of the drugs what we take are administered via the oral route. Now if you take the oral route, remember the oral route, it is safer, right? Not only safer to the patient and also economical, right? Also economical. So the oral route is safer and economical, but remember several drugs are not effective by this route. Why? Because some of the drugs, they undergo a very high first pass metabolism in the liver and as well as intestinal wall. So those drugs which undergo high first pass metabolism in the liver and as well as intestinal wall, they are not fit for the oral route. Okay, so remember this point, oral route, it is very safe and as well as economical, but several drugs, they are not effective via the oral route. Okay, why they are not effective via the oral route will be asked as a multiple choice question. Alright, so what is the reason? Number one, they will have high first pass metabolism. So they will have high first pass metabolism in liver and as well as the intestinal wall. So that means, what is this first pass metabolism is, the majority of the drug, whenever it is passing through the gastrointestinal tract, it is metabolized or excreted via the liver, or it is metabolized or not absorbed in the intestinal wall. Now let me tell you the examples of those particular drugs where they have high first pass metabolism in the liver and as well as intestinal wall. Now for example, and these examples are very important, example nitrates. Right, example nitrates, they undergo high first pass metabolism, and the other drugs are lignocaine. Right, lignocaine is a local anesthetic, or it can be used even as the antiarrhythmic drug, and the other drug what we have is a propranolol. Remember, propranolol is your beta blocker. It's a non-selective beta blocker. It acts on both beta 1 and as well as beta 2 receptors. And the other drug what we have is pethidine. So remember, these drugs are not effective orally. Why? Because they undergo high first pass metabolism. Next, now the other route of administration has come to avoid the high first pass metabolism. And what is that particular route? That is your sublingual route. right? That is your sublingual route. Now if you take the sublingual route, the advantage of the sublingual route is it avoids the first pass metabolism. Okay, the advantage is it avoids first pass metabolism. Alright, so that is the advantage of the sublingual route. And remember, because it avoids the first pass metabolism, what is the advantage of the sublingual route is the sublingual route is used in emergencies, right? The sublingual route, the advantage is it is used in emergencies. And the other advantage of the sublingual route is the drug can be self-administered. Alright, the drug can be self-administered. It does not require any special assistance for the administration of the drug via the sublingual route. Now for example, you take the intravenous route, intramuscular route, intrathecal route, right? In such routes of administration, you require a special assistance for intravenous, for intramuscular, intrathecal, or whereas for the sublingual route does not require any special assistance. The drug can be self-administered, right? Next, and the other point is after getting the desired action, the rest of the drug which is present beneath the tongue can be spit out, right? Sublingual route is the route where the drug is administered beneath the tongue, right? So once the desired action has come to the individual, the rest of the drug can be spit out. Okay, so the other advantage is after achieving the desired action, rest of the drug can be spit out. So that is the advantage of this particular sublingual route. Now, what are the examples of the drug which are administered by the sublingual route? So the drugs include nitroglycerin, right? The drugs which are administered by the sublingual route, they include nitroglycerin, and next to the nitroglycerin we have some more nitrates, that is isosorbide dinitrate, right? The other drugs include isosorbide dinitrate, and then we have an antihypertensive drug, that is clonidine, right? Antihypertensive drug, that is clonidine, and then we have a calcium channel blocker, that is nifedipine, right? We have a calcium channel blocker, that is nifedipine. So these are the drugs which can be administered via the sublingual route. Alright, so let me shortly revise up to here. So continuing with the routes of administration, you take the local routes. The drugs which are administered via the intra-articular is your hydrocortisone, and whereas the intrathecal route is your amphotericin B. And you take the oral route. The advantages of the oral route is that the oral route, it is safer and as well as the economical. But the point is, the several drugs are not effective by this route because they undergo high first pass metabolism in the liver and as well as intestinal wall. And let me tell you the examples of those drugs which undergo high first pass metabolism. The examples include nitrates, lignocaine, propranolol, and as well as pethidine. And you take the sublingual route. The advantages of the sublingual route is it avoids the first pass metabolism, and it can be used in emergencies, and it can be self-administered, and after getting the desired action, the rest of the drug can be spit out. And the examples of the drugs which are administered via the sublingual route, they include nitroglycerin, isosorbide dinitrate, clonidine, nifedipine. These can be the drugs which can be administered by the sublingual route. Now let me tell you the examples of the drugs which are administered by the transdermal route. Alright, the examples of the drugs which are administered by the transdermal route. Now if you take this transdermal route, remember this transdermal route is used only for the drugs which are highly lipid soluble. right? It is only for those group of drugs which are highly lipid soluble. Alright, so highly lipid soluble drugs, they are administered via the transdermal route. And the other point is, these drugs, they can be absorbed through the intact skin. Right, these drugs can be absorbed through the intact skin. So remember, transdermal route is used only for the drugs which are highly lipid soluble, and they can be absorbed through the intact skin. Right, the other point is, by this route, right, by this route, there is a constant release of the drug. That is a very important point what you should remember. So by this route, there is constant release of the drug. Now let me tell you one important point here. You see, the rate of drug delivery to the skin is less than the maximum absorptive capacity of the skin, so that the absorption does not become the limiting factor and there is a constant level of the drug in the blood. So a point what you should remember here is, via the transdermal route, there is a constant release of the drug. So here the rate of drug delivery the rate of drug delivery is less than, it is less than the maximum absorptive capacity of the skin. Maximum absorptive capacity of the skin. Alright, next. Now, for which reason? So that the absorption does not become the limiting factor and there is a constant level of the drug in the blood. And the other point is, by this route I have said you there is a constant release of the drug, and it may be administered less frequently because there is a constant release of the drug. So the other advantage is, this drug, it is administered less frequently. This drug, it is administered less frequently. Now, what are the examples of the drugs which are administered via the transdermal route? Remember, the drugs which are administered via the transdermal route include nitroglycerin, mainly in patients having the pain associated with the myocardial ischemia. We give or we put a transdermal patch of the nitroglycerin over the precordium or over the chest wall, and that will reduce the pain of the myocardial ischemia or myocardial infarction. Next, we have what is called as the nicotine patches, as a part of the de-addiction in smokers, we use this nicotine patches. So this will give you the constant release of the nicotine concentration in the blood, and the other drug is the fentanyl. Fentanyl patches we usually use mainly to reduce the pain in the individual, and the other drug what we have is a 𝐒𝐮𝐬𝐵𝐴𝑡𝑦L, which is an antispasmodic drug. So the 𝐒𝐼𝐻 is another drug which is administered through the transdermal patch. Alright, now let me tell you the drugs which are administered by the nasal route. So the drugs which are administered by the nasal route. Now if you see the drugs which are administered by the nasal route, the drugs what we have is nafarelin, the drugs are the nafarelin. And remember, this particular nafarelin, it is a gonadotropin releasing hormone agonist. Okay, so this is a GnRH agonist. Then we have calcitonin, which is administered via the nasal route, right? Calcitonin, it will maintain the calcium levels within the body, right? What exactly it will do is, it will take the calcium from the blood and it will see that the calcium is deposited into the bone. And the other drug is your desmopressin. Remember, desmopressin, it is one of your vasopressin analog, and this desmopressin is mainly used in patients with the diabetes insipidus, and that too central diabetes insipidus. Now, so these are the drugs which are administered via the nasal route. Now, let me tell you about the inhalational route and what are the drugs which are administered via the inhalational route. Now, so if you take the drugs which are administered via the inhalational route, that is through the nose. Remember, inhalational route is the route by which the rate of drug delivery can be controlled like IV infusion. Okay, so here the rate of drug delivery can be controlled. So that is the advantage of this particular, the inhalational route. Now, if you take the drugs which are administered by this route include examples like the drugs which we use in the treatment of asthma, right? The drugs which we use in the treatment of the asthma. Now, what are those drugs which are used in the treatment of asthma? They include, for example, salbutamol. Salbutamol, remember, it is a beta-2 agonist, right? It is a beta-2 agonist. And then you have ipratropium bromide, which is an anticholinergic drug that can be administered via the inhalational route. Then you have the montelukast, which is a mast cell stabilizer that also can be used via the inhalational route in the treatment of the asthma. Then we have even inhalational steroids, right? Inhalational steroids are basically the anti-inflammatory drugs, and that is why they are used in the treatment of the asthma. Now, apart from these drugs which are given via the inhalational route, we have some more drugs which are given via the inhalational route. So we have what is called as the inhalational anesthetic agents. Right, we have inhalational anesthetic agents. Now, if you take this inhalational anesthetic agents, they include the examples nitrous oxide. Right, the example is nitrous oxide. So these are the drugs which are administered via the inhalational route. So let me shortly summarize up to here. You take the transdermal route. The transdermal route is used only for the drugs which are highly lipid soluble and can be absorbed through the intact skin. Now remember, by this route there is constant release of the drug, in the sense the rate of the delivery of the drug is less than the maximum absorptive capacity of the skin, so that the absorption does not become the limiting factor and there is a constant level of the drug in the blood. Right, and the advantage of the transdermal route is, because the constant level of the drug is maintained because of maximum absorptive capacity, this is administered less frequently. The examples of the drugs which are administered via the transdermal route is the nitroglycerin, nicotine, fentanyl, and as well as hyoscine. These are administered through the transdermal patch. Now, you take the drugs which are administered via the nasal route. Remember, the nasal route of administration, the example is like we have naphylin, that is a GnRH agonist, then you have calcitonin and then desmopressin. You take the inhalational route. The inhalational route is the route by which the rate of drug delivery can be controlled like IV infusion, and the drugs administered by this route include the drugs for asthma, like for example you take salbutamol, ipratropium bromide, montelukast, and as well as inhalational steroids. And then we also have the inhalational anesthetic agents, that is nitrous oxide, that is also administered via the inhalational route. Now let me tell you the drugs which are administered via the rectal route. Right, the drugs which are administered via the rectal route. Remember, the advantage of the rectal route is the rectal route avoids the first pass metabolism to 50% extent, right? So the advantage is this avoids first pass metabolism to 50%. Alright, it avoids the first pass metabolism to 50% extent. Now what are the examples of the drugs which are administered via the rectal route? The drugs which are administered via the rectal route, they include diazepam, right? They include diazepam. So diazepam is given by this rectal route in children for febrile seizures, right? This is a very important multiple choice question. So diazepam, it is given via the rectal route in children, right, via the rectal route in children for febrile seizures. Okay, so for the febrile seizures, diazepam is given via the rectal route. Now you take the other route of administration, that is the intravenous route. Remember, intravenously drugs can be administered as bolus or via the infusion, right? So if you take the intravenous route, the advantage is the drug is administered either in the form of bolus or in the form of infusion, right, or in the form of infusion. Now the advantages of this intravenous route is the intravenous route of administration drug, it has 100% bioavailability, right? What exactly you mean by the bioavailability and all, I will be discussing in the further part of the session. But remember, the intravenous route, right, the drug has 100% bioavailability, and other parenteral routes, they include the intramuscular and as well as the subcutaneous. So summarizing the various routes of administration, right, summarizing the various routes of administration, you take the drugs which are administered via the sublingual route. The sublingual route, the drugs administered are nitroglycerin, isosorbide dinitrate, clonidine, and as well as nifedipine, which is a calcium channel blocker. Nifedipine is a calcium channel blocker. Clonidine is an antihypertensive drug. Then you take the drugs which are administered via the transdermal route. The drugs which are administered via the transdermal route, they include nitroglycerin, and then we have nicotine, fentanyl, and as well as the 𝐒𝐲𝐶𝐵𝐈𝑛𝑒𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛𝑡𝑒𝑛, via the nasal route, right, via the nasal route. The nasal route administration is, that is nephrilin, which is a GnRH agonist, then you have calcitonin, and then desmopressin. So these are all the various drugs which are administered via the various routes of administration, that is sublingual, transdermal, and as well as nasal, intravenous, rectal, and intramuscular, and as well as subcutaneous. So this completes the discussion on the various routes of administration of the drug.